Hello, my name is Rebecca Flowers. I've been an occupational therapist with specialty in pediatrics and in a neurological frame of reference called sensory integration for almost 35 years. I say that by way of telling you that I've had a lot of experience with working with babies and children. And within 4 years of graduation as an OT, I discovered another tool to add to my toolbox of knowledge that has helped me tremendously over the years. It's called CranioSacral Therapy. It's out of the osteopathic community, and it was brought to us, it was popularized in the 1970s, the early 1970s, by Dr. Upledger. It is the craniosacral system that we're going to be talking about is the one system in the body that houses the entire central nervous system. So we're talking brain, we're talking spinal cord. And that being said, there's very little in terms of problems that we have physically as well as socially, emotionally, because all of those things are brain function too. So there's very little that cannot be helped by craniosacral therapy. The premise of craniosacral therapy is that if we mobilize the bones, which, by the way, Dr. Upledger with his team of researchers at Michigan State in the 70s proved there is movement that continues through the lifespan of all of the different bones at the sutures. That's what these wiggly, squiggly lines are called. That movement and that system, that membrane system, is continuous all the way down to the tailbone. And it's continuous from the meninges lining the skull through the hole in the base of the skull. So let's begin now to talk about misshapen heads, helmets, and torticollis. Some of you listening may be very familiar with that with your own child, or if you're a therapist with a patient that you've seen, or maybe you have a relative or you've seen a child out in public and you've wondered, why are they wearing that helmet? Most of the time those helmets, by the way, are called doc bands. But what's going on? What's wrong? Well, we're not going to look at it as baby being broken. We're simply going to look at it as coming from the craniosacral system. Now, many doctors today will tell parents that if the baby's head is flat on the back, which, by the way, is called brachiocephaly, where it's just flat, straight across the back, then it's just because they have to lay on their backs. And you all know that the pendulum has swung from when I was a baby, babies were laid on their side or on their tummies to sleep. My children, who are in their 40s, late 40s, slept on their tummies as they got older, slept on their side as they were infants. They didn't necessarily enjoy sleeping on their back, so sometimes they did and sometimes they didn't. Well, you know that now doctors are saying, oh, they must, they must. I'm quite certain that that pendulum is going to swing from where it was with being on tummy or any position back to that. But we are now still in that place of doctors saying baby needs to lay on the back. And because of that, we have a flattened head. Well, then, what about when we have a baby that it's flattened only on one side? Let's look at that for just a second. So, what I just spoke about, baby's head is more flattened to the back, okay? That's brachiocephaly. But if we then take a look at what if baby has their head cocked off to one side most of the time. What's that? And why is that? Well, the doctors will probably say that it's because baby turns its head in this direction. Let's do it the old-fashioned way. Baby turns its head this direction, and now we've got flattening here. Here's baby's shoulders. Okay? That's called plagiocephaly, and it really begins to look like a head that is a parallelogram rather than a nice oval. Okay? Well, then we have another issue that comes up, rarely, but those aren't the only kinds of misshapen heads that we have. We can also have a scenario where, as baby is sitting in utero, there are a lot of compressive forces, and baby's head can be very, very narrow. So that if you looked at baby's face is very narrow, but the head is elongated this way. Okay? So rather than being that nice round oval, now we have a squished little head, and that's called dolichocephaly. So any of those scenarios will oftentimes get referred to the people that create the helmets or the doc bands. They want to change the shape of the head based upon outside forces. So it's like putting pressure on one area to get the other area to fill in. That's great for cosmetics, and the folks that do that, sometimes it's necessary. But what I tell parents, let's try craniosacral therapy first. And why? Because it's this membrane system that is torqued and pulled that then pulls on those thin little bones of the newborn baby skull and creates a misshapen head. It's misshapen from the inside out, not from the outside in. So yes, the helmet can many times, not always, but many times, change the shape of the head and make it nice and round. But it doesn't necessarily change the rest of the system. And we've got to look at that entire membrane system, because remember, we're talking about a system that includes not only the meninges in the head, but also the sac that holds the spinal cord all the way down to the tailbone. What happens is that we get from the inside a twist of the body. Can you see that? So it's a full body issue. It's not just the shape of the head. Now, along with that, if it is plagiocephaly, for example, where baby has a bit of an obligatory, it's almost like having a stiff neck, okay? So they nurse better with head turned this way. They sleep better, head turned this way, cocked off at an angle. It makes a huge difference if you try that yourself for a minute. bite down with your teeth and relax them slightly apart, and then turn your head to the side. What do you notice in your jaw? Do you feel a tension? Do you feel a pull? Do you feel like, this wants to stay there and this wants to go that way? It begins to change everything on the inside, creating what we call strain patterns. So when we're talking about misshapen heads, we've got to look at the entire body, and craniosacral is the one system that does that. As we do that, it's a gentle, oftentimes what we call unwinding, or letting the whole body unravel the stuck places, the restrictions that created a bit of a twist in the first place. All right? Now, what causes the twist? What happened there? Well, sometimes, you know, for those of you that have been pregnant, that as baby grows in that last trimester, there's not much space to move around for that baby. That's why babies need to get themselves turned by about the 7th month so that they're in an upside down position. After that, it becomes much more difficult. So, what happens? Well, it can happen from position in utero. And this is something covered in our curricula on conception, pregnancy, labor, and delivery in much, much, much greater depth. But what can happen is that the suspensory ligaments of the uterus can be just like any other muscle. You can have a tight muscle, you can have a lax muscle, you can have a tilt, and so on and so forth. And as baby grows and develops in the womb, if there is a torque in mama, there can likely be transferred to the baby that same kind of a developmental pattern. More often than not, it has to do with the birth itself. So, as baby is being born, there are 7 cardinal stages. And again, this is covered in much, much, much greater detail and depth in our upper level conception. We call it Conception, Pregnancy, Labor, and Delivery Craniosacral Curriculum. We cover it to a certain extent in pediatrics because we're going to see children with misshapen heads who aren't still newborns. We're going to see babies that are 4 months old, 6 months old, 12 months old, 3 years old. So, we need to know about it. As baby comes through the birth canal, head is lined up with shoulders initially. Baby is lying this way. Baby, when it begins to come through the pelvis, it rotates its head 90 degrees to its shoulder. That 90 degrees then allows baby to come through the birth canal, and once they have crowned, then there's a rectification and baby rotates like this. Then one shoulder is born, the other shoulder is born, and baby comes out. So in that process, if there has to be the use of forceps, or if there's a twist, if there's a vacuum extraction, which takes a lot of force to pull baby out, that twist can be further induced, okay? And that oftentimes is one of the big factors when we talk about plagiocephaly. But irregardless of what kind of misshapen head the baby has, if we address it from inside out, we are going to get much better health down the road. We are going to have all systems functioning optimally, rather than just relying on helmet or dock band to do it from the outside and address only the head.